Every man thinks he knows what positions women love, but most are completely mistaken. And I don't say this to provoke, but to open an honest conversation. I am Dr. Jocelyn, a urologist at the Mayo Clinic in Rochester, Minnesota. With over 30 years helping couples reconnect and rebuild trust and intimacy throughout my career, I have heard thousands of versions of the same story. Men who try hard, who sincerely love, but end up wondering why she seems distant or distracted just when they should be closest. And almost always, the answer isn't in passion, but in physiology. How the female body responds, what she needs to feel comfortable, safe, and above all, fully alive. In this video, we won't talk about tricks or cinematic fantasies. We will talk about human science, practical anatomy, and respect. I will explain the 5 positions that women truly enjoy, not out of fashion, but because they better suit their bodies. And also 2 very popular positions that often cause discomfort in practice. But most importantly, you will learn why they work by adjusting angles, rhythm, and contact, so that the experience is natural and mutually satisfying. If you stay until the end, you will understand a simple principle that transforms any relationship. True intimacy is not about doing more, but about feeling better, reading the body's signals, and responding with intelligence. Let's get started. Before entering into positions, there is a simple truth that will change the way you understand intimacy. And if you don't understand it, everything else makes no sense. Most men, even the most attentive, believe that female pleasure depends on the same things that give them pleasure: rhythm, depth, and intensity. But a woman's body doesn't work that way. Her pleasure is based on 2 pillars that must always be present at the same time: a steady, comfortable blood flow to the pelvic tissue, and reliable external stimulation right at the front of the pelvis while internal movement occurs. That combination of flow and contact is what allows the brain to receive the correct signal. Without it, even if there is affection or desire, the sensation disperses. It dilutes. For years, expert-reviewed studies in sexual medicine have confirmed something surprising. Only a minority of women achieve climax solely through internal movement. Most need or prefer simultaneous external stimulation because that is where the greatest number of nerve endings are concentrated. That's why, when a man relies only on depth or speed without maintaining frontal contact, he may feel confused. He thinks he's not doing enough, when in reality, he's doing too much of the wrong thing. I have seen couples married for 20, 30, and even 40 years rediscover their connection with just a small adjustment, reducing the range of movement and maintaining constant forward pressure, nothing more. The female body responds to the rhythm of stability, not haste. And here comes another point that many forget: relaxing the nervous system. When a woman is tense, anxious, or forced to adapt to an uncomfortable angle, her brain interprets the sensation as something to control, not enjoy. But when she feels safe and the body receives gentle contact, the parasympathetic system activates, circulation improves, and the sensation flows naturally. That's why favorite positions are not the most flashy, but those that allow easy contact at the front, gentle angles, and freedom to move effortlessly. This will be our map for the rest of the video. We won't seek perfect positions, but smart adaptations that respect physiology and prioritize both partners' comfort. From now on, each posture we see will include 3 things. 1, what makes it special from a clinical point of view? 2, how to adjust it for greater comfort. 3, what signs to observe to know if it is really working? Let's start with number 5. Number 5, side the silent spoon. This position seems simple, almost too everyday to top a list, but in clinical practice, it is one of the most effective and beloved by couples seeking comfort, connection, and duration. Lying on your side reduces muscle effort, protects the joints, especially in people over 60, and allows constant closeness without losing eye contact or physical affection. From a medical perspective, this posture keeps the pelvis parallel, creating a smooth, sliding internal angle. This anatomical detail is crucial. It prevents deep thrusts that can cause discomfort and facilitates pressure control. Additionally, it allows one hand to remain free in the front, helping to maintain the external stimulation we mentioned earlier. Dr. Jocelyn's clinical advice: place a small pillow or a folded towel between the knees. This aligns the hips and prevents pelvic rotation that can cause lower back tension. Keep the movement short, rhythmic, almost like a gentle sway. The key is not in strength, but in maintaining contact between the base of your pelvis and the front of your body. When that contact is sustained, the sensation multiplies, and the female body responds without the need for speed. In practice, many couples find that this position becomes even more pleasurable if they alternate between short movements and a gentle sway of the hips. There's no rush. The secret is to stay there breathing together rather than seeking depth. Number 4, sitting on the edge or on the lap face to face. This position is as intimate as it is practical. One person sits on a firm surface, such as the edge of the bed or a stable chair, while the other settles on their lap facing them. Physiological benefits. Direct eye contact stimulates the release of oxytocin, the bonding and trust hormone. Chest-to-chest contact helps synchronize breathing and reduces muscle tension, promoting steady blood flow. In this angle, the pelvis of the person sitting remains fixed, while the partner sitting on top can control the rhythm and depth. This stability turns friction into a rocking motion, maintaining constant pressure on the front of the pelvis, exactly where most women feel the greatest pleasure. Clinical advice. Think about rolling and pressing, not pushing and pulling. Keep the pelvis base in full contact. If you want to vary the intensity, simply tilt the torso slightly backward or forward to change the angle without losing alignment. Both hands are free. One can maintain balance and the other can provide external stimulation. Additionally, this position is excellent for older adults or those with limited mobility. It requires no strength or flexibility and can be maintained for longer without fatigue. Number 3, face-to-face lying down. The classic rediscovered. Some call it the most traditional, but when done with attention and knowledge, it becomes one of the most profound and emotional and physical connection. Body-to-body breathing in the same rhythm allows reading micro-expressions on the face, something considered in sexual medicine as a factor of neuronal synchronization. When a couple can read signals of pleasure or discomfort, the nervous system adapts and the body responds better. From a clinical perspective, face-to-face positioning maintains a neutral penetration angle that can be optimized by placing a small pillow under the hips of the receiving partner. This tilts the pelvis, aligning the inner surface with the area of greatest sensitivity on the front. Dr. Jocelyn's clinical advice: shorten the range of motion and apply gentle pressure forward at the end of each thrust. This constant pressure prevents the sensation from being interrupted, and continuous frontal contact maintains the simultaneous stimulation that most women need. If you want more intensity without increasing depth, do not use more force. Change the angle with a folded towel. Small adjustments, big results. This position also promotes nonverbal communication, rubbing, kissing, and eye contact. All of these activate brain regions associated with pleasure and calm. A relaxed body feels more. Number 2, woman on top, control and confidence. This is the position of conscious control and is probably the most underestimated by older men. Here she sets the angle, rhythm, and depth. She can adapt at any moment, adjust her posture, and direct the sensation to where she feels it best. This not only increases her pleasure, but also reduces the risk of discomfort or pain, which is essential in mature age. In large clinical surveys, most women describe how they deliberately change the angle of their hips to keep the sensation right at the front of the pelvis. This position allows doing so naturally, effortlessly, and freely. Clinical advice: forget rapid vertical movements. Think of circular or gentle swinging motions, keeping the pelvis pressed against your partner's pelvis. This way, external contact remains constant and blood flow is not interrupted. If the knees get tired, there are safe variations. You can support yourself with your hands on your partner's chest or advance one knee to reduce muscular effort. You can also partially support yourself on a pillow behind. This position also has a powerful emotional benefit. The feeling of autonomy and control increases confidence and connection because it eliminates the fear of discomfort. And when the body feels free, pleasure flows naturally. Number 1, from behind, precision and alignment. This position, often misunderstood, generates mixed opinions in surveys. Some women find it too intense, while others describe it as one of the most pleasurable. The difference lies in the adjustments of angle, rhythm, and contact. When done without attention, it can feel too deep or impersonal, but when performed with proper alignment, it becomes one of the most complete. Clinical principle: the secret is in the tilt. If the person receiving the position slightly brings their knees together and rotates their hips slightly forward, the internal angle changes. Instead of direct pressure toward the back, the friction falls on the inner front surface where the tissue is more sensitive. Acronym Dr. Jocelyn's clinical advice. Place a pillow under the hips to accurately adjust the angle. Use slow sliding movements. Do not push hard. Keep one hand steady at the front to ensure constant external contact. And most importantly, communicate. Ask, look, feel. Confidence does not interrupt the moment. It deepens it. In recent studies, couples who apply these adjustments report a significant increase in pleasure and emotional connection, especially when the movement remains gentle with pauses and shared breathing. Acronym Dr. Jocelyn's clinical summary. All these positions have something in common. They do not seek performance, but alignment. They focus not on strength, but on preserving frontal contact and maintaining constant blood flow. That is what science confirms and what thousands of couples discover when they stop trying to impress and start listening to their bodies. So far, we have discussed the 5 positions that most often promote comfort, flow, and emotional connection. But in my consultation at Mayo Clinic, when I talk to older couples, the same question always arises. Doctor, what about the positions seen in movies? Are they really as good as they seem? The answer is clear. Not always. Some look spectacular, but physiologically they are unsustainable or even counterproductive. Let's look at the 2 most common ones. 1. The standing shower position. In theory, it seems romantic, spontaneous, passionate. In practice, it is a physical challenge that the female body rarely enjoys. Medical reasons. The slippery floor reduces movement control, muscles tense to prevent falls, and water removes natural lubrication. This makes the tissue more sensitive and can even cause small irritations. Additionally, the internal angle is almost always too vertical, creating unnatural pressure on the cervix. The result is discomfort, tension, and a complete loss of frontal stimulation. How to transform it? If the idea of a water environment appeals to you, simply move out of the direct flow of water. Use a stable surface like the edge of the bathtub or a firm bench where both can support themselves. This restores balance and allows for eye and frontal contact without forcing postures. The moment retains the same intimate atmosphere, but now it is safe, comfortable, and real. 2. The acrobatic position with knees near the ears. Very popular on the internet, but almost always problematic in real life, especially for women over 45 years old. Medical reasons, this position requires extreme flexibility in the hips and lower back, causes tension in the pelvic ligaments, and can compress nerves in the lower back. Additionally, the entry angle is often too direct, which puts pressure on sensitive areas. What appears on screen as depth often feels like pain or excessive exposure in the body. How to transform it? To achieve a similar feeling of openness and closeness without causing tension, place a firm pillow under the tailbone or hips. This reduces leg flexion and softens the internal angle. Movement should be short, slow, and accompanied by breathing. Adding a hand to the front or a gentle touch on the abdomen helps maintain the sensation where pleasure is truly felt. Both positions show the same error pattern. They prioritize form over feeling, which is the opposite of what conscious intimacy seeks. The couples who enjoy each other the most, especially after 50 or 60 years, are those who read the signals, adapt, and replace attention with synchrony. Passion is not measured by acrobatics, but by the connection you achieve without saying a word. At this point, many men ask me the same thing during the Mayo Clinic consultation with Dr. Jocelyn. So, it all comes down to a single area at the front of the pelvis. Not exactly, but understanding this principle changes the entire experience. Most sexual medicine studies conducted in the last 20 years, including research from Indiana University and the Kinsey Institute, agree on the following. A small group of women can reach climax solely through internal movement, but most need or prefer simultaneous external stimulation. And not just for intensity, but because this combination causes the body to respond in a more balanced and pleasurable way. From there, a simple and elegant rule emerges. Choose and adjust positions that maintain constant frontal contact. And then think about depth, speed, or rhythm, not the other way around. If you prioritize depth before establishing stable contact, pleasure disperses. The brain stops registering sensations as pleasurable and interprets them as repetition. That's why often what seems like intensity turns into disconnection. 3 practical ways to maintain a constant sensation. 1. Breathe together for the first 30 seconds. It may seem minor, but it's not. Synchronized breathing activates the parasympathetic nervous system, responsible for calm and emotional connection. When both breathe at the same rhythm, the pelvic muscles relax and circulation increases. A calm body feels more and reacts better. 2. Shorten the range of movement. In population studies, most women who describe pleasurable experiences talk about short movements with constant pressure forward. The female body doesn't need large entries and exits. It needs continuity. Think about balancing, not pushing. When you maintain frontal contact, blood flow is preserved and the sensation is never interrupted. 3. Use smart support. Pillows are not a concession. They are clinical tools. A folded towel under the hips can completely change the internal angle by realigning the contact surface. This way, you avoid using more force and achieve more comfort and control. In older couples, this simple adjustment can make the difference between effort and harmony. The role of rhythm and body awareness. The ideal rhythm is neither fast nor slow. It is the one that maintains constant pressure at the front. During the first few minutes, a steady, almost meditative time allows the female body to recognize sensations and imprint them onto the nervous system. Only when she begins to respond clearly through her breathing, movements, or sound can the depth or speed be gradually increased. Doing it earlier is like building on sand. The body has not yet found its foundation. And something fundamental, mental presence. The most powerful contact is not always in the hands or the body, but in attention. Listening, observing, noticing how her breathing or tone of voice changes is the most precise way to guide the moment without guessing. The body speaks. Science only translates its language. Micro adjustments, tilting and swinging. In modern medical research, 2 movements are described that, although minimal, transform experience, inclination, and swaying. Most women use them unconsciously. The inclination changes the internal contact angle, while the swaying maintains constant friction at the front. They are small, slow movements coordinated with breathing. When the partner accompanies them, no further action is needed. The body finds its own rhythm. Keeping a hand or a point of contact on the front of the pelvis, whether with the hands on the abdomen or with a soft accessory, is the difference between almost and there it is. This is not an opinion, it's evidence. Studies show that women who receive constant external stimulation during intercourse report significantly higher climax rates than those who do not. And all of this requires no technique, only conscious intention and delicacy. The true art of mature intimacy lies in understanding that small details. Breathing, pressure, rhythm, angle do not diminish spontaneity. They create it. Surveys about favorite positions are useful, but they hide a detail that science confirms every day. In clinical practice, there is no single ideal position. What women and mature couples enjoy most is not a specific posture, but a condition. The ability to adjust the angle and maintain frontal contact effortlessly. This means that positions are just structural frameworks that you adapt. True pleasure arises from the personalized adjustment that each couple creates within them. When I observe couples over 60 who have regained their connection, I notice a clear pattern. They do not focus on technique, they focus on listening. They have learned to read small gestures such as a quickened breath, a slight hip movement, a barely audible sound, and to respond attentively without breaking the rhythm. That ability to read the other person's body is a form of emotional wisdom. It is not taught in any book, but it can be learned through presence. 3 signals that guide better than any manual. 1. Breathing. When she begins to breathe more deeply or sighs rhythmically, the body is aligned with the sensation. If she holds her breath or tenses, it's a sign of tension. Slow down, change the angle, or get closer to regain contact. 2. Stillness. Often the most intense moment is not in movement, but in pause. When both remain still for a few seconds, the brain interprets that stillness as safety. Tension decreases and the sensation expands. Learn to hold those silences. They are not emptiness, they are fullness. 3. Muscle tone. A relaxed body feels warm and receptive. A tense or stiff body is protecting itself. If you notice resistance, don't insist. Adjust your posture, support one hand, speak calmly. Tenderness does not interrupt passion, it deepens it. Communicate with elegance. Talking during the encounter is not a weakness. It is a sign of maturity. A simple phrase like, "that's okay," or "do you want me to stay like this?" can open a huge door to trust. Kind communication reduces anxiety and activates the brain's reward system, creating a feeling of immediate closeness. Dr. Jocelyn summarizes it this way in her workshops at Mayo Clinic. The body has its own language, but the voice can be its most accurate translator. In other words, asking does not extinguish the moment, it illuminates it. Mature intimacy is not about discovering new positions every night, but about rediscovering the same person with greater understanding. Sometimes a small change is enough, a higher hip, a shorter movement, a firmer hand, so that the body can once again feel at home. If you're seeking closeness and communication, start face-to-face. Keep movements short, smooth, and in sync with your breathing. Support one hand on the front of the pelvis and press your body forward, not backward. The goal is not depth, but continuity of contact. The more consistent the pressure, the easier it is for both of you to relax and synchronize. If she wants more control over the rhythm, invite her to be on top face-to-face. Let her set the angle, speed, and sway. Don't worry about guiding her. The female body knows how to find its point when given freedom and support. Your steady and calm presence is more powerful than any quick movement. If both seek a deeper internal sensation, try the position from behind, but with attention. Before starting, place a pillow under their hips to adjust the angle and reduce the depth. Keep one hand or gentle pressure on their front. The combination of internal and external contact is what transforms an intense posture into a pleasurable and safe experience. And if they want to close with calmness and tenderness, switch to the side spoon position. Breathe together without haste. At that point, words are unnecessary. The warmth of the body, the rhythm of the chest, and shared breathing become the most human language there is, the thread that connects everything. It is not a technique nor a hidden secret in a book. It is a simple and universal principle. Stable comfort at the front of the pelvis, an adjustable internal angle and movement that maintains the sensation. That is what research shows. That is what bodies confirm when they learn to listen to themselves. And that is what turns any moment into a truly intimate memory. In sexual medicine, we often say that pleasure is an advanced form of communication. It's not about performing, but about understanding, letting the body speak and responding with attention. Mature love does not seek to impress, it seeks to understand. After 60, the body changes, but sensitivity does not disappear. It simply needs new conditions to express itself. Every muscle, every breath, and every pause can become a bridge between two people who choose each other with respect. I am Dr. Jocelyn, a urologist at the Mayo Clinic in Rochester, Minnesota. My wish is that this knowledge serves you not only to improve your intimacy, but to experience it with more serenity, empathy, and science on your side. If this video helped you see things more clearly, share it with someone who also wants to learn how to care for the connection with kindness and curiosity. Because true intimate health does not start in the body, but in the way we choose to look at, touch, and listen to each other. And remember, age does not extinguish desire.